Hi, I'm Ripley.
And I'm Kelsey Clare.
We're working with the Maine General Integrated Risk Reduction Program. This video is about emergency opiate overdose kits and how and when to use one. Sometimes a person can have a bad reaction to opiates. We call this poisoning or an overdose. Here in Maine, we lose one person every other day from drug overdose. That's more deaths per year than highway crash deaths. The most common drugs seen in overdoses are opiates. Opiates include prescription painkillers like Oxycontin, Percocet, Vicodin, methadone, and fentanyl, as well as street drugs like heroin. Opiates are addictive drugs that slow down systems in the body. During a bad reaction or overdose, breathing can slow to the point of death.
Emergency opiate overdose kits help people at risk for poisoning along with their family and friends in case of an overdose. The kits have prescription naloxone in a cone-shaped nose piece instead of a needle to give the medicine to the victim as a spray up their nose. Naloxone, also known as Narcan, is a safe, legal drug that reverses opiate overdoses. It has no side effects, no potential for addiction, and it does not interact with other medications. If someone is overdosing on something other than an opiate and naloxone is administered, there's no harm done, but they still need medical care. Naloxone works because it puts the person into withdrawal from the opiates. Programs in other states have saved thousands of lives thanks to family and community members knowing how to use emergency opiate overdose kits.
So let's talk about what an opiate overdose looks like. Common signs include snoring, not responding, not breathing, turning blue, vomiting, seizures, and confusion. If you check on someone by calling their name and shaking them and they don't respond, try the sternal rub. You take the bony part of your knuckle and rub hard on the sternum or breastbone. You can also rub on the upper lip. If the person doesn't respond, they are in serious trouble. Call 911 and begin to administer naloxone.
If the person is not breathing, they will need rescue breaths. Place the person on their back. Tilt their chin up to open the airway. Check to see if there's anything in their mouth blocking the airway. If so, remove it. Plug their nose with one hand and give 2 even, regular-sized breaths. Blow enough air into their lungs to make their chest rise. If you don't feel their chest rise out of the corner of your eye, tilt the head back more and make sure you're plugging their nose. Breathe again. Give 1 breath every 5 seconds.
Your kit comes with 3 parts: the barrel, 2 doses of naloxone, and the cone-shaped nose piece. First, take off all of the caps. 2 yellow caps on the barrel and 1 purple cap on the naloxone. Then, hold on to the nose piece and screw on the barrel. Take the naloxone and put it into the barrel with no pressure, twisting gently. Now you're ready to use it. Place the nose piece up 1 nostril and give half the dose. You'll have to push hard on the end of the tube to make sure it comes out in a spray and not a dribble. Then give the rest of the dose up the other nostril. If it all goes into 1 nostril, it's okay. Just make sure all of the naloxone is used. Even if the person isn't breathing, the naloxone will go through the lining in their nose. If you do not see a positive change in 3 to 5 minutes, give the second dose of naloxone. It's important to know that while naloxone reverses an opiate overdose, the naloxone wears off faster than opiates. So that means even if the person overdosing hasn't taken any more opiates, they can overdose a second time. It is really important that they don't take any more opiates. You need to stay with the person and wait for the ambulance. Let's watch a scenario where someone uses their kit.
Step 1. Check for signs of an overdose. Is the person unconscious, limp, or unresponsive? Step 2. Try to wake them up. Yell out their name in a loud voice and shake them gently. Step 3. Rub chest bone. Rub your knuckles hard up and down in the middle of the person's chest. If the person wakes up, try and keep them awake. Step 4. Check breathing. Place your ear next to their mouth to see if they can feel or hear a breath. If there are no breathing sounds or you don't think the person is breathing, call 911. Step 5. Call 911. Stay calm and tell the 911 operator that the person is not breathing and/or they are unresponsive. Step 6. Give naloxone. Step 7. Clear their mouth. If the person is not breathing, check their mouth and remove any objects such as food, chewing gum, or even vomit. Gently lay them on a hard surface on their back. Step 8. Perform rescue breathing. Tilt the person's head back with their chin up. Pinch their nose closed with your fingers. Seal your lips tightly over their mouth. Gently breathe into their mouth 2 times in a row. Their chest should rise, not their stomach. Step 9. Put them in the recovery position. Once they are out of danger, place the person on their side with legs bent and head resting on their arm on the floor. The recovery position lets fluid drain from the person's mouth so they do not choke. Step 10. When 911 arrives, tell them you use naloxone and how many doses you gave. If you're not able to stay with the person, leave the emergency opiate overdose kit next to them.
So that's the emergency opiate overdose kit. If you have any questions on the kit, overdose prevention, or the integrated risk reduction program, give us a call at 207-872-4102.